On the wards, pharmacists and technicians will ensure discharge letters are created with the right information about medicines to ensure a safe transfer of care when our patients leave hospital. Once a letter has been finalised and then authorised by a pharmacist, they will either send a Slack message to their dedicated ward dispenser that discharge medicines need to be dispensed on the ward, or add the request for discharge line to the pharmacy electronic medicines management system to indicate that medicines need dispensing in the dispensary. This also allows discharge medicines to be tracked through the dispensary process on the prescription tracker. If a prescriber has not been involved with the generation of the prescription list on ICE and medicines have already been supplied or need dispensing, then a prescriber signature item will need selecting on ICE and an ink signature and prescriber's details written on a printed copy. This signed copy should be given to your dedicated ward dispenser if being dispensed on the ward, or podded to the dispensary immediately to prevent delays in releasing those discharge medicines. The receptionist in the dispensary will check the pod station and place signed ICE letters upright in the concertina file for ACTs to marry up. On wards, a dedicated ward dispenser will log into the desired patient's record using the patient's hospital number. In the dispensary, the next patient to be dispensed is found from the all dispensing work list and picking the patient at the top of the list, and then in both cases clicking the active PMR ATO icon. Once in the patient's record, click Edit and copy their hospital number by highlighting it and pressing Ctrl and C keys together. Then click Cancel. Flip into ICE and select any ward location and paste the hospital number into the search field using the Ctrl and V keys together, and then click Search. Copying and pasting in this way prevents an unintentional transcription error of hospital numbers and means you are always going to get the right patient record. Click on the patient's line and with the Discharge tab open, select Discharge by Patient. A list of all hospital episodes for your patient appears. You need the current one. This is usually at the top of the screen, identifiable as having an admission date but no discharge date. If it's not there, click on Admission Date once or twice to resort the episodes so the most recent is at the top. If the letter is authorised, there should be a green tick icon, or rarely there will be a closed envelope symbol, which means the letter has also been completed. Sometimes there's also a green arrow through the envelope indicating the letter has been sent electronically to the patient's GP. If there is no icon, a document icon, or a red exclamation mark icon, then there is no authorised letter to dispense from, and you must contact the ward pharmacist to ask them to resolve the issue. To proceed, click on an authorised letter icon and click on the Print TTO List button to print the letter. Make sure your letter defaults to 2 sheets per page and double-sided, so you only print 1 page of paper. Check the ICE letter to see what needs dispensing or relabelling, circling or highlighting anything that needs to be dispensed. Now, flip back to the pharmacy system so that you can make sure matching medicine lines are available to dispense. What happens next depends on what you find in the PMR. Check that the allergy box has been updated for this episode. It should be. If it says Confirm Patient Allergy, then contact the ward pharmacist or technician to correct this, or update it yourself if your system permissions allow. The allergy information will be on the ICE letter. Now, check to see if any of the items that need dispensing already exist and that they match the doses and frequencies on the letter. If there is a matching line and it is clinically checked, then you can go straight to dispensing. If there is a matching line but it states a clinical check is required, then highlight that line and click the Conditional Check button. If the medicine is listed in the current episode but has a different dose or frequency, highlight the line and click Amend. You may then edit the fields which are different before pressing Send to bring the revised item into the current episode. If the medicine is listed with identical instructions but is from an earlier episode, highlight the desired line or lines and click the Reconcile button to bring the items into the current episode. If the medicines is listed in an earlier episode but with a different dose or frequency, highlight the line and click Copy. You may then edit the fields which are different before pressing Send to bring the revised item into the current episode. If there is no matching line, click New ERX and start creating prescription lines for labelling, ensuring that the doses and frequencies match the description on the printed ICE letter. When you have entered and amended the lines, click Send. If the patient requires a blister pack, remember to add Plus Pack on the PMR so that this can be dispensed. Highlight any new and edited lines. Use the Shift key to highlight the top and bottom of the desired list range, or cherry pick items by holding the Control button down while selecting or deselecting the desired items. Then click Conditional Check. It is important to note the Conditional Check button is a step in the electronic system to move the item to the supply and check stage. It is not certified as a pharmacist's clinical check. This is done by the pharmacist when they authorise the ICE Transfer of Care Discharge Letter. Once all of the lines that require dispensing are correct and visible in the active PMR ATO, click on the dispensing button for whichever site you are on and commence the dispensing process in the normal way. The accuracy checker will make sure the right medicines have been dispensed with the instructions that match on the ICE Transfer of Care letter and liaise with the person dispensing to make any required changes. They then clear that patient from the checking list so that the tracker shows a live number of discharging patients still in the dispensary system. As an ACT, you should only release medicines when you have a signature, be it electronic or in ink. The revised procedure helps get medicines to patients sooner so they have a great experience and leave hospital in a timely manner. And it will reduce the amount of dispensing our teams have to manage after the formal closing time, so we have a great experience too.